All right, well, welcome, welcome. We're here at the senior station in Portsmouth with What's Up, Doc? Let me hear it, seniors. We've got, you hear that? We've got a big energetic group today. Some of the ladies were telling me we're celebrating Dr. Martin Luther King's birthday today, right? So we've got a breakfast planned after the show, so we better get moving, hadn't we? We don't want the breakfast to get cold. Who's been watching the news? Let me just ask a few questions before we start the show. What are we having an epidemic of right now? Flu. How many people have had the flu here in the audience? Couple, not many, thank goodness. How many people had their flu shot this year? Oh, that's my seniors. That's what I'm talking about, love it. I'll tell you what, people are trying to get that flu shot now. We're running out, but it's still not too late. We're seeing one of the biggest flu seasons we've had in a number of years. Lots of sick people in our offices. Let me just remind you, the flu, cough, fever that comes on suddenly, body aches, headaches, sore throat. So be vigilant. We really need to be washing our hands. If you blow your nose, throw the tissue out, or you can use the hand sanitizers, the alcohol. Try and avoid touching your face. If you're out in public like this and you touch things, try not to put it near your nose, or your eyes, or your mouth, because that's how the flu is transmitted. And if somebody's sick, stay home, please. Don't get out in public and give it to everybody else. If you do get symptoms, and by the way, even those good folks in here that have had their flu shots, it's only about 50 to 60% effective, so you can still get the flu even if you've had a flu shot. So if you get symptoms, come to the doctor. If you're getting sick, and there's medicines we can give if you start it in the first day or two that will help you get better faster from the flu, and will help you not spread it. So use caution. The Center for Disease Control say we still have about 3 to 4 weeks of flu that we're going to see yet. So we're right at the peak right now. It's starting to tail off a little bit. Does anybody know, let me ask my seniors particularly, what's the danger that can happen with the flu? What can you get as a result of the flu? Does anybody know? Pneumonia, very good. Pneumonia, the main reason young people and older people die is they get pneumonia with the flu. So if you get the flu and then you're getting a little bit better and then you suddenly get sick again, that's a danger sign that you need to see your doctor. So just some tips about the flu. Well, we're not going to talk about the flu today. I hate to bring it up with a nice meal coming, but we're talking about an important topic for seniors and for all of us really. We're going to talk about constipation today. And I've got Dr. Tristan Sumabat. I hate to say he's an expert on constipation, but he is an expert on constipation. So come on back and join us. I'm going to bring Dr. Sumabat out. We're going to talk about constipation, what causes it, what we can do about it, what we should watch out for. Come on back and join us on What's Up, Doc? Well, welcome back to What's Up, Doc? We're here in Portsmouth, and we've got an important topic, I think, for seniors. You know, most of our audience tends to be our senior patients, although I hear lots of people watch and enjoy our show. We've never talked about this topic, but it is an important topic. It's not the easiest topic to talk about, but constipation is something we see a lot. And we've got Dr. Sumabat, one of my partners here today. Tell us a little bit about yourself, Tristan.
Oh, well. Hi, Dr. Bagazzi. Thank you for having me here at the show today. My name is Dr. Tristan Sumabat. I am a resident over at Portsmouth Family Medicine, and I'm actually...
Can you speak up louder, please?
Speak up a little bit louder. I'm sorry. My name is Dr. Sumabat. I'm a resident over at Portsmouth Family Medicine, and I am really glad to be with you here today.
Well, we're talking constipation, so I wondered if you could start by telling us what do we mean by constipation. I think it has lots of different meanings for different people, but what do we usually mean by that?
Well, it's true. Constipation generally refers to a change in bowel habits. Okay, it does have a varying degree of definitions for different types of people. It can be that some people describe it as you having a hard stool, a small amount of stool, that you might be straining when you have a bowel movement, having infrequent amounts of bowel movements a week, say approximately maybe less than 3 times a week. And these symptoms can be quite troublesome to some people.
So sometimes they feel like they don't empty their bowels all the way. And I mean, I guess it's pretty variable, but what's a normal, you say is 3 times a week the usual for people, or what do we usually call a normal amount of bowel movements?
Well, normal really depends really on the individual. It varies from person to person. It can be as much as 3 times a day to as less as 3 times in a week. Okay. So, but the thing is that you should know, the main point is that it varies from person to person. It's not one set definition.
So if it's a bothersome thing and they feel like they're not having enough, or it's uncomfortable, or it's a change, that's something we should be cautious of, right?
Yes.
Well, how common is constipation? Is it a common thing?
Well, actually, it's quite common. I know you asked the audience here just a few moments ago, and a lot of people were saying they know a lot about constipation. It actually accounts for probably about 2.5 million visits to a primary care doctor's office each year. In general, it can happen for a multitude of reasons, but as you get older, constipation becomes more prevalent. Usually after the age of 65, a lot of people do complain about constipation issues.
So that's something I see a lot in my senior patients for sure. Yeah. Well, what are some of the causes? Why do we get constipation?
Well,
other than getting older.
Well, the causes they can be a lot, but usually it's the delayed movement of food through the intestine. So whenever food moves slowly through your intestine, your stool can become dry and hard, making it hard for you to pass your stool. Now, what slows down this transit, this movement through your intestine? Well, like I said, it could be a lot of things. But usually it's mainly due to your diet. Say if you're not having a lot of fiber, you're not drinking a lot of water. Another reason being that you might not be as active. Physical activity can help move along your bowel movements pretty well. Another common thing in the senior population is medications. Say if you are taking some opiate pain medications, that can slow down the transit and give you some hard stool. If you're anemic and you're taking some iron supplements, you can have constipation. Another common one is that if you're using antihistamines or cold medications, that can make you constipated. And at the same time, laxatives, things that are supposed to make you go to the bathroom, if you use that too often, you can have constipation from that also.
So that's a lot good tips, and it sounded like a lot of those things were lifestyle things. So just to review, drinking a lot of liquids, and water, I guess, is one of the best things. Fiber, and how do we get fiber in our diet? What are some ways about getting fiber?
Well, getting fiber in your diet, basically it's just you can do some healthy food choices, as you probably have been told. Some of the things that you can eat in your diet is like dried fruits, prunes, apricots, fresh fruits and vegetables, the green stuff. Usually about 2 to 2.5 servings a day is usually what they recommend. Actually, the American Dietetic Association recommends that you get probably about 20 to 35 grams of fiber per day.
20 to 35 grams a day. And then there's bran kind of fibers too, that you see in cereals and things like that. So drinking a lot, fiber in the diet, and then being active, moving around, exercising, walking, that all helps with your bowels to function normally too. Well, if you do have this problem, are there treatments besides these diet changes that we can use?
Oh yes, there are some over-the-counter medications that you can use. These are, there's some things called like supplements, some bulk-forming agents like Metamucil. These kind of give your stool a little bit more mass, make them a little bit more softer. And also you can use things called some other laxatives, such as a Miralax or a suppository, which will help you move.
Some of the safer ones then would be the bulk or the powdery ones like the Miralax or the lactulose, things like that. What about these strong stimulant laxatives like Senokot, see some of my patients use Synacot, X-Lax, Ducalox. What about those?
Well, these are medications that help stimulate your bowel to have a bowel movement. They are safe, however, you have to make sure that you're not using this on a regular basis. So it's really important that you actually use the other stuff that we were talking about earlier, about having lots of water, lots of fiber, and if that doesn't work, usually you can try a laxative.
Some of the milder laxatives, if you're going to use them, but the stimulant laxatives, you can overdo it with those and even sort of become a little bit dependent on those sometimes, I think. Well, now finally, let me ask, if you have constipation that's going on for a while, that can be associated with some dangerous things too. When should we, like for example, tumors or blockages, when should we go to the doctor about this constipation?
Okay. Usually, some of the things that I tell my patients when they come to the office is that, well, you should be coming to see us if you're having some, like your symptoms, if they're getting worse, or if your constipation is associated with things like fever, okay, blood in your stool. Weakness, unexplained weight loss that you have been noticing. If you have any of these symptoms and constipation, it's probably a good idea to go see your doctor.
And don't forget, we recommend that all of us should have screening for colon cancer. That might include a colonoscopy where they look up in your colon every 10 years, or some kind of test to screen your bowels for colon cancer, so you need to see your doctor about that. But certainly blood or weight loss or some of these dangerous symptoms should prompt you to go sooner. Well, let's take a break. Let's take a station break. We're going to come on back and I'm going to go in the audience. Thanks for those great tips on constipation. And come on back and join us on What's Up, Doc.
Get caught buzzed driving, and you could do some hard time.
Craig, knock it off.
Sorry, Mom.
It could cost you around $10,000 in fines, legal fees, and increased insurance rates. And that could set you back a few years. Buzzed, busted, and broke. Because buzz driving is drunk driving.
Quiet, please. Wait a sec. I'll take one. Oh yeah. All right. All good. Take care. Way to go. Nice. Bring it on. Gotcha. I'm here for you. Oh no. Please, please, please. I'm waiting. Interesting. Not buying it. Not fair. That's it. This conversation is over. Oh, brother.
Body language can tell you all sorts of things.
I'm having a stroke. I'm having a stroke.
Know the sudden signs. Learn fast. F. Face drooping. A. Arm weakness. S. Speech difficulty. T. Time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
NFC, AFC, offensive linemen, defensive tackles, quarterbacks, and cornerbacks are all working with United Way for a million little reasons. The kids of our communities, to ensure their academic success all the way to graduation day. You see, it takes about 12 years to create a graduate, but it takes the same time to create a dropout. And the difference between a kid becoming one or the other could be a professional athlete, or it could be you. Studies showed the earlier we get to kids, the better their chances. So become a United Way volunteer reader, tutor, or mentor, and make a difference in the life of a child, for the life of that child.
Give.
Advocate.
Volunteer. Live United. Join your favorite NFL players. Take the pledge. Go to unitedway.org.
For those dealing with the daily struggles of caring for a loved one, we hear you. That's why AARP created a community with experts and other caregivers to help us better care for ourselves and the ones we love.
Welcome back to What's Up, Doc. We're here with Dr. Sumabhat. We've been talking about constipation, and I saw some hands going up in the audience, so I'm going to sneak my way back here. I saw this young lady had a question for me. Ma'am, what's your name?
My name is Jean.
Hey, Jean. How are you today?
I'm doing good, thank you.
Good. Did you get your flu shot?
No, I did not.
Oh, Jean. Wash your hands good, okay? What was your question for Dr. Sumabhat?
I have a question. It's not for me. It's for my cousin. She's 82, and she always be constipated, you know. And like she take a lot of different stuff, you know, but it doesn't do no good, you know. And right now she constipated right now, tell the truth, you know. And she just have a hard time.
So she's older, 80-something.
She's 82,
and she has chronic constipation.
All the time.
So Dr. Sumabhat, any tips for that, for Jean and her friend about that? What can we do about that?
Well, in regards to your friend, when she comes to in regards to her constipation, there are, just as I mentioned previously, some things that she can do is, like, I don't know how her physical fitness is or anything of that sort, but if she can just do a little bit of activity into her regular daily regimen, probably some walking, adding and increasing some water intake, that would probably be the best thing. Now, if she is still doing all the kind of lifestyle changes and still having this problem, I would really recommend that she go see her doctor and get checked out.
Yeah, one of the things we see if it goes on long a time is, let's look at the med list she's on, make sure there's no meds that are causing it. Let's check her thyroid, make sure she's not low thyroid. She might need a colonoscopy if she hasn't had one for a while.
She never had one.
So that's a good tip right there.
Yeah.
You might advise her to go do that. Thanks.
She's an older person. She's kind of scared of stuff.
Yeah. Well, that's understandably at 80 you don't want to do things that are too aggressive, but still, if she's having a problem, it might be worth checking out. But thanks for the question.
Thank you so much.
Yes, sir. Hold on, let me see what your name is. You got a question here? We're going to come over. Mr. Watkins, what's your question, sir?
My colon cancer doctor told me to take Citracil every night.
His colon cancer doctor said take Citracil every night. What is Citracil? That sounds like a good plan. What is Citracil, Dr.
Citracil is also a bulk forming agent. Basically, it basically helps you make the stool into softer, bigger stool that helps you push it on out.
And your name's Watkins?
Right.
So what do you think about Mr. Watkins taking that every night? Does that sound like a good idea?
Well, the thing is that, well, if he's taking it every night, that's usually, it's pretty safe in that regard. But at the same time, I would recommend him actually, adding some other things like we've been previously talking.
Fiber in the diet,
Fiber
exercise.
diet.
Good. Yeah, I think that's a good, safe thing. Now, I saw a hand up. Thanks, Mr. Watkins. I saw a hand up over here. Let me come over here, ma'am, and let me ask you if you would tell us your name.
I'm Elnora.
Hi, Elnora. What's your question?
Is it true that some people have died from constipation?
Can you die from constipation? Ooh, that sounds scary. Can it be a dangerous thing where people actually get sick and die?
Actually, yes. Constipation can be that serious in the sense that the constipation might not just be from lifestyle causes. It can actually be caused by disease, such as intestinal obstruction, tumor. It could be a cause of some underlying disease. Other things like lupus, hypothyroidism. There's a long list that if it goes untreated, you could have some issues with that. Yes.
And actually, there's this thing, Elnora, called impaction. You ever heard of impaction? If you go long enough without having a bowel movement, it gets stuck. And in older people particularly, you can actually get really sick and you can get infected from an impaction. You get what we call sepsis from an impaction and can die from that. So that would be something where sometimes we have to mechanically remove the stool, like with enemas and things like that. So fortunately that's rare, but it can happen.
One other question.
Sure.
For those people that are limited in activity, will exercising your abdomen help?
Absolutely. Any kind of exercise where you're using your muscles, because it's really strengthening the core. Even you can do that in your seat. Strengthening the core abdominal muscles that has the biggest impact. Don't you think, Dr. Sumabhat? Yep.
Okay, thank you.
All right, we've got one last question here. I see in the back. Yes, ma'am. What's your name?
Cynthia Sturdivant.
Hi, Miss Sturdivant.
I not long ago had a bowel blockage and an intestinal blockage. Could constipation be related to that?
So let me just ask. And did you have to have surgery for your bowel blockage, or did it get better?
No,
they were able to. put a tube out, and so that's a serious thing. So you had a bowel blockage, and could constipation be related to that, Dr. Sumabat?
Oh yes, intestinal blockage is definitely can cause you to have constipation. It can be, that intestinal blockage can be caused by a multitude of factors, and so it's a good thing that you were able to get treated and that your blockage was able to be relieved.
Before that time, the only time I had ever been constipated was when I was carrying my child pregnant.
And pregnancy is another common time we see constipation because the baby's in there blocking things up, and sometimes our diet changes. But the point you're making is, I think, an important one. Sometimes constipation can be a danger symptom, and it can be a symptom of things like blockage, which sometimes, if it's bad enough, that could end up being surgery. Fortunately, you didn't have to have surgery, but yeah.
They said they couldn't do it with the tube. They got it with the tube.
So now you need to use extra caution about your diet, make sure you don't get stopped up again, you know.
Another, you said fiber.
Yeah.
What can we eat to produce fiber?
So fiber comes really in sort of two main forms. There's the sort of vegetable fruit fiber, you know, and then there's bran fiber, like you see in bran cereals, and I really like bran fiber for constipation. So, you know, raisin bran and Fiberall and these high fiber bran products, or whole wheat bread as opposed to white bread. Whole wheat bread is much better for you. Any other bran or fiber choices you can think of, Tristan?
It's like Fiber One bars.
Yeah, Fiber One breakfast bars with Fiber One. Those are all
some
great
yogurt, all that kind of stuff. Yeah, that's good stuff.
All right, well, thanks for those great questions, and let's thank Dr. Sumabat for joining us on What's Up Doc. Come on back next month. Hey, let's go get some breakfast.